The field of geriatrics is certainly complex. People become more complex as they age.
Oh, that feels good.
It is not simple care. It's not routine care. Every case is unique and different.
It's challenging in a way because you really call on so many things, your communication skills, your observation skills, your assessment skills, that I think it's really the ultimate challenge.
That's why it's extremely important to advance education.
Is there a certain place where they would look for it first, though? Is there a better place to have it?
I'm a great believer in education, and so I think that it's important for nurses to be able to progress from an associate degree to a bachelor's, master's, and doctoral degree. The role for nurses is increasingly important in delivering needed care to the older population, and so the more education, the better, really.
First, I want you to see wolves there around.
Yeah.
Every time I've taken this step, and I went from a BS to a MS to a PhD, it's opened up a door every time. You know, getting a master's degree, it allows you to expand your scope of practice, to be more of a leader in your practice, and to begin to do some research.
As you go from the baccalaureate degree to the master's program, you become more specialized and you can care for special populations like the elderly. At the doctoral level, the PhD level, that's really a degree that will prepare you to be a researcher and to really show leadership in areas such as academics, practice, as well as research.
Yes, that's understandable.
That would be...
You get the skill set that not only can you help disseminate the knowledge that's out there, but you can actually help develop that knowledge that people use, and that's incorporated into nursing education programs. So the opportunity to be a part of that is important.
If you go on to have a PhD degree, you would have the opportunity to be a gerontological nurse educator, whether it's at an associate degree or baccalaureate degree program, or even at a doctoral degree program.
And by being an educator, you're forced to just really continue to learn. You're always learning. You learn from your students. They're challenging. They're always asking wonderful questions.
Is that excruciating pain for a woman?
That's going to be, they're going to have a lot of symptoms by the time you feel it.
It's just a great role.
And they need immediate surgery for that as well. Yes.
The more advanced degrees also give nurses an opportunity to engage in policy and politics, and that is where practice is decided and developed, and it gives a venue for increasing your voice.
So it's just a widening of your influence. As a bedside nurse, I made a difference every day for patients that I cared for. But what the doctoral degree provides is being able to make a difference widely in many patients.
I flew into Japan.
It is just so satisfying to hear the stories, to see the family connections, to see children and grandchildren and great-grandchildren around someone, to see the culture, the history that they've experienced. It's very engaging to work with older adults.
It's one of the most exciting fields because the care of older people is really the most complex care of any patient population. And it means that nurses who are really, really smart and really, really astute are the ones that we need to be recruiting into the field.
The reason why people go into nursing is because they want to make a difference in the lives of patients that they care for. Encouraging students to go on in their education is to help them understand how they can continue to make a difference in the lives of patients and families.